Hi, I'm Robin, dental hygienist. We're filming in Hilbert, Wisconsin, Hilbert Family Practices. Today we're talking about brushing and flossing. A lot of people are familiar with a toothbrush, of course, and dental floss, but not a lot of people know the true significance or the proper technique. So those are a couple things that we're going to talk about today. And the real significance of having a proper daily brushing and flossing routine is because of the research that's been found linking gum disease with heart disease. My son Zach is here today. He was willing to help me out with this. And the first thing that I wanted to talk about was plaque. I wanted to explain the definition as found in the American Dental Association, which is a great website for finding out information about things. Plaque is definitely, here I have a good visual of plaque and how it's completely covered in this person's mouth. As you can see, it's very generalized. This person was a person who came in, and we actually took the photos here. He admitted to rarely brushing or flossing his teeth. Definitely some areas right here you can see how it's definitely formed. And you can also tell that the gums are a little bit swollen in reaction to the plaque, and the reason for that is because plaque does have toxins in it, and that is definitely something that we want to prevent. Gingivitis is also what will happen if you have plaque left on your teeth and you aren't able to properly floss and brush your teeth. And this is a good picture just displaying the red rolled gum tissue. It bleeds easy. Can definitely see that this person has, here's another spot that you can definitely see that it's very inflamed. And gingivitis is reversible with brushing and flossing. It's totally reversible. Once it invades deeper into the gum tissue, then it's considered periodontal disease, and that information is according to the American Academy of Periodontology. So this is definitely something that we want to prevent from happening. Of course, the best way to prevent gingivitis or gum disease, periodontitis, is by having a proper brush and floss technique. And this information you can find on the American Dental Association's website. And it's important to brush your teeth twice a day for 2 minutes. And I'm going to actually show how to do a proper job of that using Zach. Okay. Now what you actually want to do, I have a toothbrush here, is you actually want to, I don't know if you can zoom in on there, you want to hold the bristles against the tooth and against the gums. You can do circles if you want to, or a back and forth motion, whichever is more comfortable. Toothpaste is not necessary. If you can dry brush if you don't prefer to have toothpaste. But again, it's important to watch the clock and watch for that 2 minutes. You're going to come all the way around. It's good to have a pattern so that you don't miss areas. So it's good to form a habit of that. So as you can see, I'm just lightly brushing, going against the tooth, going against the gum tissue, very lightly. You can come back around this way, starting on that back tooth, coming forward. I'm not going to brush for the entire 2 minutes here, and that's just due to time. But just to give you an idea, this is an area where you can hold the toe of the toothbrush as such, so that you can really do a good job removing the plaque from this area. But again, 2 times a day for 2 minutes is the ideal. And the next thing I'm going to show you, usually we use about 18 inches or so of dental floss, and it's good to wrap it around these middle fingers using your pointers to reach in the back teeth. So what I'm going to do here is, I don't know if I need a light, I'm good. If you put your chin up a little bit for me. So I'm going to reach way back here, and what I'm doing is I'm adapting the floss underneath the gum tissue. You want to think of your gums as like a turtleneck around your tooth, and that's really where the bacteria likes to creep down below and cause that gingivitis. I'm going to show you. I'll have you pull your lip down. Then I can show on a front tooth.
The light. Maybe that'll be.
So I'm coming down. I'm making a C shape below the gum tissue, going up and down. You'll have to put your lip a little bit more down. And again on this side, you can see that you go down until you feel a resistance. You don't have to feel like you have to go all the way down, but definitely you can kind of see I'm getting below that gum tissue, a pretty good length there. Okay, so that is the proper technique for brushing and for flossing, and that again is found in the American Dental Association website. Another important reason that we really want to establish a healthy routine with brushing and flossing is due to the research that has been put forth. The American Academy of Periodontology definitely shows some good information on people with gum disease. They're almost twice as likely to develop coronary artery disease. That's a significant amount. And another study determined that DNA from different kinds of periodontal bacteria appeared in patients' heart arteries. So it's actually the arteries around the heart. They have found some dental plaques, which makes a lot of sense as far as our blood system. The bacteria can creep underneath the gum tissue, and it can travel throughout our body. So as this presentation states, it's important to have pink, tight, healthy gum tissue, and the way to achieve that is through brushing and flossing. And Zachary, do you have any questions for me?
Yes. Are there any other reasons a person can get infected gums besides plaque?
Yes, that's a good question. There are factors that can increase the risk of developing gum disease. Tobacco smoke, and actually chew tobacco as well, can increase the development of gum disease. Also, having diabetes has been shown to increase the risk of gum disease, making it difficult for our bodies to regulate our blood sugar if we have gum disease. And that is found in the American Dental Association also.
Is it possible to have gum disease with no warning signs?
And that, yes, it is, and that is a great reason to want to visit your local dentist and hygienist and have dental screenings and periodontal screenings as well.
Are there any other health risks related to gum disease besides heart health?
And that's a great question as well. According to the American Diabetic Association, research suggests that people with diabetes are at a higher risk for overall health infections and need to spend extra time in brushing and flossing, and should definitely make regular visits to their dentist for screenings and to make sure they do not have any inflammation or anything. And that is found in the American Diabetic Association website.
Oh, thank you.
Thank you very much for viewing.